I'm Dr. Anderson with North Texas Plastic Surgery, and today we're going to talk about 5 questions you should ask your surgeon before considering plastic surgery. The first question that I love patients to ask me is what they can expect their results to be or what they can hope for with their results. And that kind of tells me that they've actually given a really nice thought process to this whole thing and that they understand that there's going to be changes that are right after surgery and take a while to get to their ultimate result. That also allows me to make sure that what you want is in line with what I can actually do for you. Most patients are totally reasonable and understand that there are limitations with what can be done. And this helps me and you to get on the same page, so that way you are more likely to be super happy with what your results are ultimately. The next question that we would go over is risks associated with plastic surgery. The most common things are bleeding or infection. Those risks are very small, and as far as infection is concerned, you're gonna get antibiotics with your procedure so that we can decrease that risk as much as possible. It's important also to go over procedure-specific risks. So whether or not you're having a breast procedure, a tummy tuck, or liposuction, each one of those is going to carry with it a specific risk profile that is important to go over with your surgeon, and you can ask rates of those things happening, likely outcomes if those things happen, and if it's a serious thing or something less serious, like maybe a little bit of discoloration that will fade in time. Another great question is whether or not your doctor is board certified. So there's several things that you'll see on the internet that can be very honest and some that are slightly misleading. And plastic surgery is probably at the top of the ones where you can be misled. So somebody like me is board certified by the American Board of Plastic Surgery and the American Board of Surgery, but that's besides the point. What you will frequently see is people that say they are board certified in cosmetic surgery or aesthetic surgery. Those are not technically recognized boards by the governing body of all boards that are like for cardiologists, pediatricians, family practice doctors. Those folks that will say cosmetic or aesthetic only have a little bit of training, sometimes even just like a weekend course. And so the likelihood that you might end up with an outcome that is not what you want can be higher. In addition, it's very easy to look up people like myself that are certified by the American Board of Plastic Surgery on their website, and it will very clearly say my name and it's very easy to look that up. The next question that we'll talk about is a little higher end as far as I'm concerned, but really shows that you're doing your due diligence. And that is the surgery center accredited? I think most folks that are gonna get plastic surgery are gonna have it at a surgery center and not a hospital. You want to make sure, and your surgeon will know this for sure, that the surgery center that they're working out of is accredited by one of several different accrediting bodies. And there's at least 3 that are totally legitimate, and just ask if they're acting offended or something. That should give you pause that they're maybe not the most above board and that you should continue to do your research. The final question that we'll talk about is how can I best prepare my body for the surgery that I'm gonna go through? So this is a good conversation to have at your consultation because there's likely gonna be an interval of a month or potentially more between consultation and time to have surgery. And that can allow you to do several things to help you optimize your body for the best results. So one thing that I always talk about with folks is it's best if you're at the weight that you would like to be beforehand. What makes me nervous is if somebody says, I'm gonna have this surgery and then lose 30 pounds. Well, if we're doing something that's gonna tighten up your skin and we lose a bunch of weight afterwards, we might end up looking like we have loose skin again and we'll feel like we kind of didn't solve any problems. So that's first one. The next that's common is smoking. Smoking will increase, for sure, your risk of having wound healing complications. We are doing aesthetic plastic surgery that you certainly don't have to have, that you want to have to look and feel better. So we want to do things to minimize the risk, and quitting smoking a month before surgery is one of the best ways to diminish those risks. The next one is going to be related to medications. Lots of people are taking medications, and in this I include over-the-counter supplements, whether it's collagen powders, pre-workouts, whatever. We're gonna go over those together and ensure that you have stopped ones that can either inhibit wound healing, increase your risk of bleeding, increase heart rate things during surgery, so that we can again have you optimized to get the best result we can for you. If this video resonated with you and you want to share your experience as related to it, comment below so we can continue the chat in the comment section. If you want more content from me or the other doctors at the practice, we have a podcast that's coming out that you can watch on YouTube or across anywhere that you get your podcasts. If you're ready for more information about this video or other things you've seen me talk about, you can call our office or visit our website, both linked below.